the one thing we have to do in this discussion of health care and how it is reformed is that we've got to have a discussion about it. And so my brief comments, because I'm so flattered to have with us Dr. Marcia Angel, the former editor of the New England Journal of Medicine, and Dr. Walter Sue, Dr. Stephanie Woolhandler from Harvard Medical School, and other witnesses that you've been so kind to bring here. I just want to review with us what I think it is that we're in, and I want to extend an opportunity for our discussions to go far beyond the hearing today, and I want to make myself available to all of the members. First of all, we've got to discuss it. And the first thing that occurs to me, that there is some, and I concede this to my ranking member friend, that there's some notion that universal single-payer health care is off the table. Well, that raises a very important question. If you take the most popular health care reform measure and take it off the table, heaven knows what it is I guess you think you're left with. The one thing I commended the 44th president about when I met with him first after his election was he said something that no sitting president in my experience had ever said. He said, I want you to keep in touch with me, to keep me advised. We want to know about what's happening and what you're thinking about. And so I praised him for that. He'd made a lot of other important statements, but the fact that he wanted to keep in touch was very important to me. And so we've been keeping in touch, and citizens have been keeping in touch. I know because I've been invited around the country endlessly to some people that would like me to travel less and stay in my district more. The fact of the matter is we're dealing with, and the polls establish it, I've got something here that tells us through 2 polls that this is the most popular system in the minds of most Americans. Most Americans. And I'm going to put all these things in the record, but here are more than 400 local unions, 20 international unions, 39 state AFL-CIO unions, all resolved around this question. Now, I wish I could claim some creativity or imagination for this, but universal single payer is not a new idea. As a matter of fact, every industrial country on the planet, except one, us, already have some version of it. What we're doing is developing the American version. What we're doing, and we've examined all the systems on earth, we're putting this all together, we're studying this. We are not turning this over to government. We've got another database of myths about the system that I won't try to go into now. But we want to examine these. We cannot examine them without a hearing. So it's with some sadness that I report that it wasn't easy for me to get to that first summit that the president called. It was an enormous one. He's taken an enormous step here. We've got to help him. Here's how I'm going to help my president. he is getting some misadvice about health care. To think that this sad substitute about the Massachusetts plan, and there are people from this state that can expound on it far more greatly than I can, is going to move us forward. We're at a point now where we're either going to take this opportunity and move forward and have everybody in as a matter of constitutional right to health care, not health insurance, not policies, but health care itself, from the moment they're born to the moment that they leave Earth. Now, here are what the essentials are. And it's a 37-page bill. We're not going back to the 1994 mistake of 1,200 pages. What we're saying is, number one, everybody is afforded health insurance. Number two, they'd be paying, the rate would be about 3.5% of your income. It is not government run. It is privately administered. No one will be giving up their choice of doctor or hospital or how they want their health service rendered. It would break the employer connection, and it would create one health insurance system, one which would be devised. We would come together, whether we want combinations of existing health insurance groups or whether we want to do something differently. So I want everybody that's thinking about this to start off with number one. This is the most popular form, and it would be very unlike the party in the majority now to determine that the most popular system would not even be examined. I am asking for a hearing in every committee, and if they will let us into the Senate as well, that's very important. Now, here's the closing, members. Chairman, this is a great bill. Fantastic. I have some saying their father was a single payer. It's wonderful. Guess what? It's impossible. So we've got to go to the next best thing. What is the next best thing? Well, we're working on that. We'll be back in touch with you. I got a plan of a plan that we would like you to examine. Okay. Now, let me close with this. This country, this is where we're going to test the mettle, and this is not a test because bringing health care to 47 million people and 30 million that don't have anything. This country was founded on the basis that a third of the people wanted to be free, a third of them wanted to stay with England, and a third of them didn't give a darn what happened. It couldn't be done. It wasn't able to happen. Nelson Mandela was supposed to be in prison for the rest of his life, and he ended up the president of the country that sentenced him to a life in a penitentiary. It couldn't be done. Social Security was supposed to have been the worst thing that had ever happened. And I've got some of the debates, and you would not believe what some people said in opposition to Social Security. It couldn't be done. It wouldn't work. And what about Medicare? Medicare was fought tooth and nail. I know because I was here. And now we have Obama himself. You can't elect, please, folks, you can't elect a person of color to the highest, most powerful government position on earth. It's impossible. Get a grip. Well, it was all possible. It all could be done. And I'm asking you to consider the political necessity of bringing up a bill that they said was off the table. Then they say, well, it couldn't pass. Well, I think the American people are watching very closely. And I'm saying that now is the time. And I thank you for allowing me to make this introduction and to include the papers that I would like to be part of the record as well. Thank you for this opportunity.